Okay. I should honestly know this one because I've gotten so many, but let's see. So, what is the most likely diagnosis for this patient? So, a 28-year-old pregnant woman at 34 weeks gestation has a routine ultrasound examination. The ultrasound reveals that the fetal blood vessels are crossing over at the internal cervical os, unsupported by the placenta or umbilical cord. So this condition increases the risk of fetal vessel rupture and life-threatening hemorrhage. If I'm not mistaken, I want to say crossing the internal cervical os. I think it's placenta accreta. Yeah, I'm gonna keep it at that.
Okay. So,
Ruptio, no. Previa, no.
so let's talk about this real quick. Okay, I'm gonna see kind of what is a abrupto placenta.
Abrupto placenta is when, if I remember correctly, I think it's when the placenta like not dislodges but like disconnects and then you have painless bleeding.
So you're correct, right? So in the sense that the placenta, when you have placenta abrupta, I just remember that just abruption of the placenta, okay, just to make it easy, right? Which means
Mm-hmm.
that the placenta disconnects from the uterine wall. That's not good,
Mm-hmm.
right? Because then baby is
Yeah.
not having blood supply. That's not good. Okay, what's placenta accreta?
I think placenta accreta is the one that it crosses over and then it basically like touches the other organs, something
Um,
along those
so I
lines.
think you're I'm not sure if your explanation. So placenta accreta is when the placenta, right, invaginates deep into the uterine muscle more than it's supposed to.
So it pushes the other organs,
So
right?
so so it doesn't push any other organs. Okay, so let's talk about this, right? So
Okay.
you have accreta, increta, and percreta. Okay, I always remember in alpha order, right? They get, this is not as bad and it gets really bad. Okay, so I'm gonna draw my bad picture here. You have your uterus. Actually, your uterus looks more like a triangle. So this is your uterus. You have your placenta, right? So your placenta is supposed to naturally connect, superficially like this to the uterus wall, right? But
Mm-hmm.
placenta accreta, it connects a little bit deeper into the muscle. Okay. And then increta, okay, if you imagine the myometrium, which is the muscle layer of uterus, increta with an I is almost full thickness of the myometrium, and percreta is completely through and then can invaginate into the bladder or the rectum. Does it make sense?
Okay. So it just goes deeper and deeper.
Yep, it goes deeper and deeper, right? But so does it make sense so far? Kind of the accreta, increta, percreta?
Uh, 1 second. What, I don't know what I was thinking of that. Okay, so placenta creta, it attaches, right? It attaches to the uterine wall.
Mm-hmm. Into the
Mm.
superficial layer of the myometrium, right? Remember, it's a little bit deeper than it's supposed to connect.
So, okay, I think one step back. So we have the placenta. Um, what is, I think, I'm not sure what is meant by like the myometrium in this scenario.
Okay, so the uterine wall, right, has some mucosa, and under that mucosa, the uterus is made out of muscle. That's just called the myometrium layer.
Oh, so it's pushing against the uterine myometrium.
Yes, exactly.
Okay. Okay. All right, that makes sense. Okay. So
Okay.
I see why like the organs won't get affected.
Yep. Unless it's
Okay.
percreta, right, is all the way through the myometrium, the muscle layer, the complete muscle layer of the uterus, and then can then attach into the bladder or the rectum. Okay, that's percreta, but accreta does not do that.
Mm-hmm.
Okay, so
Okay, yeah.
what's placenta previa? Now that we've gone through these two answers, what's placenta previa?
Um, okay. Actually, now that you mention it, it's the other way around. Abrupto placenta is the one with the painful bleeding. Previa is a painless one, and it's just like um premature separation of the placenta.
No, so yeah, so that's why the reason why I'm going through this with you is a lot of people forget kind of what the diagnosis is. Remember, abrupta placenta is the one where you detach from the placenta wall. I mean, from the uterine wall, right? That we talked about, and it's usually painful. Okay, this is not your answer. Okay, placenta creda and creda per creda. We talked about those three. Those are not in. Placenta previa just means that the placenta, if you have the os right here, instead of the placenta being here, the placenta is here. And so the way I remember it, so it's easy for you, you get a preview of the placenta if you take a look through the os. Does it make sense? It shouldn't be here,
So there's no
right?
like disconnect.
Nope, there's no disconnect, right? It's
Okay,
just
it just
right
comes
over the
down.
os, which is not supposed to it's not supposed to be there. So you can have some bleeding.
Hmm. Okay, so
Okay.
that is my answer.
Okay. And then what's uterine atony?
Good question.
Okay. So what's tone, right? Atony means no tone. So that means the
Hmm.
uterus has no tone, but usually that deals with when after birth. So this is not the answer. Okay. So you're between these two. What's a vasa previa? So if I told you what placenta previa is, what's vasa previa? What does vasa mean?
So a preview of vein.
Yeah, like the vessels, right? So imagine if
Yeah.
you have your placenta here and you have your umbilical vessels kind of going like this, and here's kiddo, right? So that's not good, right? Going across the os. Okay, so which one is your answer here, C or E? So read it again here.
Okay, so blood vessels that are crossing over the internal. Just because it says vessels, I think I'm gonna go with vasa previa because perfect.
Does it make sense? So really, to be honest, with these diagnoses, people miss these all the time. Is because
Hmm.
you guys kind of, I would say, overthink it a little bit. Okay. You want to just remember what each diagnosis means if you break it down, right? Abruption of the placenta, previa, right? So that's disconnect from the wall. Does it make sense?
Hmm.
Placenta accreta, increta, percreta. I always remember in those trio because it just gets from worse to, like it gets worse as you go down the alphabet, right? That just is how much the uterus is the placenta is connected to the uterus, right? Placenta previa, right? You get a preview of the placenta over the os, right? Uterine atony usually is not within, they don't test it together with these. And then vasa previa is just the vessels. So if you
The
keep it
vessels.
kind of,
Okay.
yeah, that simple, then you'll remember it. Okay,
Okay.
perfect.